Thank you for joining us for our Tuesday COVID-19 briefing, where we share our latest on efforts to slow the spread of the coronavirus, where we will talk about rebooting our state's economy and getting Tennesseans back to work. Today I want to go over our phased reopening of the state's economy. We'll talk about our support for small and rural hospitals in Tennessee. We'll talk about our next steps for the federal stimulus money that's coming to Tennessee and our efforts to engage the minority community in the fight against COVID-19 here in our state. Yesterday I announced that I will not be extending the Safer at Home mandate beyond April 30th. I also announced that in 89 of our 95 counties, we'll begin the process of getting back to work next week with a planned and a phased reopening of our state's economy as we work to bring industries like retail and restaurants and close contact services to a safe and a methodical opening here in Tennessee. We anticipate that some of these businesses will be able to safely reopen as soon as Monday, the 27th of April, and we'll be providing specific guidances about which businesses will be opening on which dates later this week. As we work to safely reboot our economy, social distancing and proper hygiene remain as important as ever, if not more important than ever before. As we re-enter routines, Tennesseans will have to remember to keep habits like social distancing, working from home, hand washing frequently, utilizing cloth masks. And we want to encourage Tennesseans who feel sick to be certain and get a test. Stay at home if you're sick. If you have come in contact with someone with COVID-19, you need to self-quarantine. We want to continue to remain our efforts in social distancing because these are the efforts that have worked. These are the efforts that have gotten us to this place where we can begin to reopen our economy. Earlier today, I spoke with the mayors of the remaining 6 counties. I talked about 89 of our 95 counties. I spoke with the mayors of the remaining 6 counties of our major metro areas: Shelby, Madison, Davidson, Hamilton, Knox, and Sullivan counties. We reiterated our support to help these areas determine the best pathway for their safe reopening as well. As we're making progress toward reopening, I want to remind Tennesseans some restrictions will stay in place to ensure that we do this properly and safely. And while we want to have everything open as soon as possible, we will continue to discourage social gatherings of 10 or more, and we'll continue to restrict visitors at nursing homes and hospitals until further notice. These are very important restrictions because they protect our vulnerable populations like the elderly, and they also protect our frontline medical workers that are so important in this fight against COVID-19. Our Economic Recovery Group is working diligently day and night to issue guidance this week for businesses as we prepare to open and reopen next week. We have 7,394 confirmed cases. We have had that many confirmed cases in the state of Tennessee. 157 Tennesseans have lost their lives to COVID-19. We've had 3,828 who have recovered. These numbers are the result of 7,000 tests added to our total, which represents the highest number of tests added in a single day yet. And yet we saw less than 200 new COVID-19 cases appear in this total today. Our number of recovered cases continues to exceed the number of new positive cases. We are encouraged by all of this news, and most encouraged that Tennesseans have done what they should to social distance, and it has paid off. And that is why we must continue to do the same. COVID-19 has placed a considerable strain on our small and rural hospitals across the state, especially as elective procedures remain suspended to preserve the all-important personal protective equipment that our frontline healthcare workers and doctors need in order to treat patients. Earlier this month, because of the strain that has been put on these rural and small hospitals, we announced a $10 million grant program to keep small and rural hospitals open and offer services while we bridge the gap between now and when federal funding hits these rural hospitals. Yesterday, we made our first 4 grant distributions in state funds to Lincoln Medical Center, Henderson County Community Hospital, Lauderdale County Community Hospital, and Three Rivers Hospital in Waverly. In addition to the funds that we're providing to these hospitals, they have also successfully drawn down $7.5 million in federal COVID funding relief. Ensuring that these federal funds are maximized by Tennessee providers is a core objective of this grant program that we've established, and we will continue to partner with these and more hospitals. In fact, we're projecting several more applications from small and rural hospitals will be processed and verified in the coming days. And I want to especially thank the Tennessee Hospital Association and their help in working with us to support our rural hospitals across Tennessee. Funds from the federal funding, the Coronavirus Aid, Relief, and Economic Security Act, or better known as the CARES Act, those funds began flowing to Tennessee last week. Our state expects to receive in excess of $2.3 billion in federal funding through the CARES Act, with additional funding going directly to Nashville and Memphis from the federal government. This funding is a tremendous opportunity for us, but it also comes with significant responsibility to be sure that we're prudent and that we serve Tennesseans well in the way that we utilize this federal funding. So in partnership with the legislature and the constitutional officers, I've pulled together a bipartisan group intended to properly steward these all-important funds that will be helpful for us in the months ahead. Our first meeting will happen virtually tomorrow. It'll be an open press meeting, and we'll discuss major spending priorities and a review of this federal expectation, of what the federal expectations are for this funding for Tennessee. We will continue to report further about our plans for the recovery, and I'm especially grateful for Lieutenant Governor McNally, Speaker Sexton, Senator Watson, Senator Ackberry, Representative Marsh, Representative Love, and Comptroller Wilson, who will all be serving as a part of this team to steward these federal funds appropriately in our state in the days ahead. We have worked hard to fight COVID-19 in our state, and we have worked to ensure that every single Tennessean can get the testing and the medical care that they need. We are working especially in our minority communities to make certain that that happens. So I've invited Dr. Kimberly Lamar from our Department of Health to share more about our efforts, particularly to our minority communities. Dr. Lamar.
Good afternoon, and thank you, Governor. First and foremost, I want to ensure our communities, particularly our minority communities, that we are listening. We are listening and developing both strategies and actions to ensure that your voices are heard in the responses that we deliver from the Department of Health. Last week, the Office of Health Disparities Elimination launched the Statewide Health Disparities Task Force. This task force was developed and implemented to enhance bidirectional communication between our communities of color and the Department of Health. This task force builds upon long-standing relationships with a variety of community partners, and last week's meeting included over 200 faith and community partners, academic partners, healthcare providers, and state and local government officials. The purpose of the task force immediately will be to address any challenges, barriers, and needs relative to the COVID response, but we see this task force being critical as we continue to have long-term conversations and develop strategies, policies, and responses relative to health disparities overall. Secondly, we have put in strategies to ensure that our data quality is in place to ensure adequate site locations, as well as to ensure that adequate resources are in place to ensure testing expansion needs relative to both our local rural health departments as well as our metro county health departments. We are rolling out a few commercials within the next few days to, one, highlight many of our local on-the-ground frontline health and business leaders, as well as those in our community who are really serving in terms of the COVID response to be those frontline leaders, whether you're grocery or members of our clergy. We will also continue to roll out and launch commercials relative to strategies to encourage social distancing. Our motto here is to look at physical distancing and not necessarily social isolation. We are also encouraging those that are pregnant in our communities, as well as those with chronic diseases, to continue to reach out to their healthcare providers. And so these three commercials will be launched across the state, particularly having highlights in our metro areas. And then lastly, I want to highlight many of our community partners that are working with us right now to ensure the transparency of this information, to ensure that we're communicating to the needed communities, those being Memphis Congregational Health Network, the University of Tennessee Health Science Center, Meharry Medical College, as well as local and state minority representatives and those of the Black Caucus. Again, I want to ensure our communities of color that we are listening and we are being responsive to the needs that you have identified. Thank you.
Thank you. Thank you, Dr. Lamar. Dr. Piercy, I'd like to ask you to come up and give our daily health report, please.
Thank you, sir. Good afternoon. As the governor mentioned, our case count is 7,394, which is a 2.16 increase, our smallest ever day-over-day growth rate. The other notable figure today is 108,182 tests, which is about a 7,500 test increase over yesterday. We believe that the majority of these tests were collected at the weekend events on Saturday, and we expect another big increase tomorrow when we add Sunday's numbers. We've had some other large-scale increases or testing events, I should say, and so we'll see some more increases in the coming days. Wanted to give you something a little bit different today and tell you about something that you may have heard about called contact tracing. I realize that when you hear terms like tracing or surveillance or investigation, those can sound a little intimidating or intrusive. But really, those are clinical terms, and what we mean by that is identification and notification of people who may be at risk of becoming infected. This is all in an effort to improve individual outcomes for patients and to reduce risk of infections for the population at large. Just like we do with many other highly contagious diseases, a person who tests positive for COVID-19 is contacted by a clinician, usually a nurse from their local health department. They notify them of the positive result and provide immediate guidance and answer any questions they may have. After taking care of that patient, the next phase is to identify all of the people that may have been exposed by the patient who is infected. This is sometimes a painstakingly long process, requiring folks to look back through calendars and social media posts and cell phone records to jog their memories on who they may have interacted with during the previous several days. Once a list is made of all of the people with whom the patient may have been in contact, all of those individuals must be made aware of their potential exposure. It's easy to see how this number can get out of hand really quickly, so it requires increasing manpower numbers to handle all of these notifications. Additionally, once people are notified, they are asked to communicate with their health department contact daily for the entire incubation period. You've probably heard that term before, and that's the typical period of how long it might take you to get sick after you've been exposed. For COVID-19, that is generally 14 days. We ask them how they're feeling every day and to report any symptoms they may be having. The staff member can then help facilitate testing of that individual who may be showing signs of illness, and then, if that person tests positive, the whole process starts over. As you may have heard in some of your readings or in the news, testing availability and contact tracing are two key components to help us move forward and restart the opening of our economy. We know that even despite our best efforts at social distancing, our number of positive cases is going to increase when people start interacting more. So it's really important that we bring on more contact tracing staff now to help all of the 89 rural health departments that are served through the Tennessee Department of Health. Through the repurposing of state employees whose workloads may have recently been altered due to the pandemic, we put out a call to all 23 state agencies for staff who would be interested in volunteering to be temporarily reassigned to these duties within the Department of Health. We were incredibly pleased and quite frankly humbled by the response that we got. 230 state employees are now in the process of being trained to handle these tasks, which more than doubles our current workforce for contact tracing. Many of these employees are being trained even today, and some of them will have their first patient contacts before this week is over. We are grateful to these employees and our sister state agencies for supporting us in this impactful work.
Thank you, Dr. Piercy. All of these efforts are very important as we move toward reopening our economy in order that we may do so in a safe way. We know that we can do that, but we know that we must take the steps necessary. And your efforts combined with the efforts that we're ramping up here to make sure that we can continue to mitigate the spread of this virus as we reopen the economy are important to every Tennessean. I want to ask Patrick Sheehan. Maybe you're a doctor, I don't know, but I wanted to ask, he's the director of TEMA, to give us an update on our efforts around the supporting those that have been affected by the tornadoes in southeast Tennessee and our emergency declaration and the efforts that TEMA is making on the ground there in those counties affected by the recent tornadoes. Patrick.
Thank you, Governor. So, sir, no surprise to you, today you signed a letter to President Trump requesting a major disaster declaration for 8 counties. Those counties are Bradley, Campbell, Hamilton, Marion, Monroe, Polk, Scott, and Washington. And for for all 8 of those counties, that's for the public assistance programs, so that's infrastructure, emergency response measures, debris. And for 2 of those counties, Hamilton and Bradley, we also asked as a state for individual assistance for the hundreds of Tennesseans whose homes were damaged, thousands whose homes were damaged, and hundreds who lost their homes or had significant damage to their homes. As of this morning, 537 Tennesseans were still sheltered by the American Red Cross and other partner organizations. Cleanup and recovery still continues. Local organizations and the National Guard contributing in a number of ways. The estimate from the Joint Preliminary Damage Assessment is that more than $35 million in public assistance damage occurred on Easter Sunday overnight and the early morning hours of Easter Monday, the 13th of April. Still several hundred people are without power. The number that we had from our joint preliminary damage assessments conducted with FEMA and local partners is 270 structures with major damage and 289 destroyed between Bradley and Hamilton counties. A tremendous amount of teamwork continues with folks on the ground and the support from our General Assembly members from the Tennessee House and Senate, the congressional delegation, the senators, and the representatives from the areas. Commissioners in various departments continue to provide a number of support. Troopers have been on the ground for most of the time since then, supporting local law enforcement. National Guardsmen have supported feeding operations and distribution of supplies to those survivors and victims of the tornado. Hundreds of volunteers continue to work to support that area, and businesses also contributing in a number of ways, large businesses and small businesses, whether it's a big box store or small restaurants who'd already been impacted by COVID-19. And we have law enforcement officers, firefighters, EMTs, emergency managers, and especially the linemen and the utility companies who've been working around the clock to restore power. We're just thankful for their efforts.
Thank you.
Thank you, sir.
We want the folks in that part of the state to know that we continue to stand with you and will make every effort to make the recovery and the rebuilding of your community possible. And we want to do everything we can, but we're particularly grateful, as Patrick said, to all that are engaging in that, from volunteers to law enforcement to frontline workers. We're grateful for all the work that's come together like Tennesseans do, to respond to a tragedy like the one that unfolded on the night of Easter and the storms across our state. Take heart, Tennesseans, we are making efforts, and we are making progress, and we are moving forward, and we are encouraged about the numbers. We're encouraged by the data, but what we're most encouraged by is what Tennesseans are doing to help other Tennesseans and to help us all together move our state forward through this pandemic in a way that minimizes the health effects and minimizes the economic effects to Tennesseans all across our state. So we're happy to take questions, open up the lines and we have with us, by the way, again, as always, members of our Unified Command Group here, members from the Department of Health, from TEMA, to answer any questions that you might have.
Thank you, Governor. First, we'll go to Jonathan Mattice with the Associated Press. Jonathan, your line is open.
Hey, Governor. Thanks for taking our question. A lot of other states have teamed up in different sort of groups to reopen. Is that something that you're considering doing? And why or why not would you consider that?
Well, I've certainly talked with governors all across the country. I've been doing that for weeks now. We have weekly calls with the National Governors Association. I have calls with governors in our region about the efforts that they're taking. So we're not coordinating a group effort to move forward, but we certainly are talking one with the other about how it is that we individually move forward in our states. Governors all have the same goal, and that is to protect the lives of their citizens and to restart at the right time their economies. And that's what every governor's doing. That's what we're doing here in Tennessee. We don't have a formalized effort with other states, but we're certainly working together to share best practices so we can do what's best for Tennesseans. Thank you.
Next, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Good afternoon, Governor. My question today pertains to the guidelines that the White House has released for beginning the process of reopening businesses. So per their gating criteria, states shouldn't move forward with reopening until they've seen 14 days of downward trajectory or decline in positive cases. So we've seen more than a couple weeks of single-digit increases as a percentage of the overall cases, but not a sustained decrease. So is Tennessee fully complying with the guidelines provided by the White House to reopen? And if not, have you all gotten the green light from the White House to do what we're doing?
Well, as you know, the White House has given the decision on when and how to reopen to individual governors. And we actually are on our 18th, we've had our 18th day. As you heard Dr. Piercy say earlier, our day-over-day increase today was the smallest number in all of those 18 days. So the day-over-day increase has been single-digit for 18 days, but it on balance has continued to decline throughout that period. That's what's been driving this decision. It's a piece of data that is incredibly encouraging, particularly as we see that today's numbers, for example, had 7,000 cases, but had less than 200 new confirmed cases. So we know that we're in the right direction. There are a lot of other things that we want to make sure are in place too. Our hospitalizations and our available hospital beds have to be at a capacity that has been sustainable and that will allow for a caseload. That's the case. That is true in our state. The guidance has indicated that there should be broad and increased testing, which we have worked really hard to do, and today was the largest testing number day that we've had. So we really believe that Tennesseans have done what they were called upon to do, and we've achieved the results that we wanted to achieve in order to be in a place where we can begin a phased reopening that is strategic and smart and safe, and that's been our plan.
Today, Knox County's health department announced that their demand for testing has exceeded their capacity. They've suspended tomorrow's drive-through testing. They're going to switch to appointment only later in the week. do you support a county reopening if they don't have enough testing supplies?
Well, I'll tell you, I'm going to let Dr. Piercy specifically address our testing, but the expansion of testing has occurred in every region of the state. And there will be a case or a day or a particular drive-through pop-up site that may run low, but on balance, our testing capacity continues to increase. And we are testing more and more every day in many of our regions and in almost all of our major cities. Like I said, there'll be an up and down, but the testing expansion has been true for the entire state. You want to add to that, Dr. Piercy?
Sure, the governor's correct that it's sometimes difficult to predict demand on any certain day. And for those of you who were at our testing sites on Saturday, we did a pretty good job of keeping up with demand, but that's because our partners, specifically in the National Guard, as well as our Department of Health staff, really were agile and flexible in picking up things and shifting supplies and human resources between sites. And that's no different in Knox County either. We've been in contact with Dr. Buchanan there, who is the health official, and she has requested those supplies, and I got confirmation a little while ago that she will have delivery of those on Thursday of this week to get them back up into normal operations. So we're willing and able to help any partner across the state, particularly those health departments that are doing such important work for testing.
Dr. Busey.
Next, we'll go to Sergio Martinez Beltran with WPLN. Sergio, your line is open.
Thank you, Gil. Good afternoon, Governor. You talked about how some restrictions will still remain in place even when the executive order expires. You talked about restricting social gatherings of 10 or more people. This week we saw protests where people, there were hundreds of people in front of the Capitol. Are these protests violating those restrictions, and what is the state going to do to keep enforcing that?
Yeah, I think it's most important that Tennesseans remember that the reason we got where we are today is because we have been very vigilant and diligent as a population in our social distancing efforts, and we need to continue to do that. And the requirements will continue to be that we encourage gatherings of 10 or less. And when that happens, we certainly want to address those and talk about those events and discourage that kind of activity. We've had really very little problem with that across the state. We expect that we'll continue to not have a significant problem with that across the state. And when we have it, we want to talk with those groups and tell them why it's so important that they keep one another safe and that they keep others safe as well.
Expecting more protests this month, and I'm wondering, have you talked to, or your office has talked to the groups that organized this week's protest, and what's the type of conversation you're having when many of them are not even using cloth masks?
Well, again, we haven't specifically addressed that group, but we want to address and talk to and encourage any groups that gather and do not, employ social distancing to do that thing, and I mean to do that very thing, and we'll do so. When we see that happening, we'll address with those groups, and because we believe that. We really believe that Tennesseans do want what's best for one another across the state, and we all know that social distancing works. We know that a virus that spreads with social contact, with human contact, the way to prevent that is by providing social distancing. So we'll encourage that for every gathering and every meeting.
Warner.
Thank you.
Next, we'll go to Andy Scher with the Chimes Free Press. Andy, your line is open.
Hi, thanks, Governor. I had a question about the tornado damage. So this letter went out for requesting a federal declaration for disaster today. Am I correct on that, or?
That's correct.
Okay.
I signed that letter today.
Can I get a copy?
I signed that letter today, and that letter was submitted to President Trump today.
Can I get a copy of that?
I certainly can.
Okay. And so you're saying it's a total of $35 million in damage
Yeah, I'll let
Was that
Patrick,
correct, or-
I'm gonna let Patrick Sheehan talk about the details of that declaration.
Hi, Andy. Yeah, over the 8 counties that we submitted, or the governor included in the letter, is approximately $35 million in damage, public assistance.
I'm sorry, $35 million in damage and public assistance?
Public assistance categorized damages. So that doesn't include houses, it doesn't include residential structures, cars. It just includes the public assistance program grants.
And any estimates on what houses, residential, businesses, structures, and that sort of thing is?
In the aggregate loss, no, not yet. So we have some, not yet. We're working on those figures now.
And how soon do you expect to have those?
We'll have some figures by the end of the week.
And if I can follow up, when would you expect to put that in the form of a presentation to the federal government?
So the figures don't get reported to the federal government in that way. So you ask for individual assistance by doing a joint preliminary damage assessment. So FEMA, personnel on the ground with TEMA, some other state partners, and with local personnel, building inspectors, first responders. And so more than 250 structures were categorized with major damage. More than that were destroyed between Hamilton and Bradley counties. And so that's how those figures are reported for requesting a major disaster declaration that includes individual assistance.
Okay. And I guess, for those who lost their buildings, they'll be dealing with their own respective insurers if they have insurance companies or have insurance policies.
That's right. So insurance is the first line of defense for anybody. That includes public assistance costs. So insurance costs are not eligible. The federal government doesn't allow double dipping. So everyone should be, again, and now we're 7 days into this, so documenting expenditures, documenting keeping their receipts, taking lots of pictures, documenting the damage, and everyone at this point, a weekend, should have at least talked to their insurance provider at this point.
Thank you.
Thank you, Andy.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Thank you, Governor. I'm going to go back to Natalie's question about 14 days of declining COVID cases as a White House guideline for reopening state economies. Are we ignoring that deadline or that guideline, or are we just saying it doesn't matter as to where we are right now?
No, we've had, on balance, over the last 18 days, a decline in the number of day-over-day cases that we have seen as a state. So if you look at the single-digit percentages over those 18 days, they go up and down, but they steadily, as on aggregate, decline, and that is consistent with a decline over a 14-day period of time in cases. Again, today was the lowest of those day-over-day case number increases, which is consistent with that aggregate decline. Dr. Pierce, do you want to add to that data?
Sure. So we watch every day, have a big spreadsheet of all of the different metrics that we're watching. And as the governor mentioned, 18 days ago was the first time we saw that day-over-day growth rate be in the single digits. When we first got into the single digits, from memory, it was in the upper 8s, I believe, and we have watched it trend down over the last 18 days. And anytime you're looking at a trend, it is just that. You're going to have little blips. We call that statistical variation. You're going to see that, but on balance, as he said, it goes down. And so 18 days ago, we were at 8 or 8.5. For the last several days, we've been in the 2 to 3 range. You also have to remember that on those days where you have blips, those might have been days where we did targeted testing. For example, if we tested a population that had, if we tested 450 and 150 of those were positive, that's a 30% positivity rate. That's going to take your overall number up that day, but the next day it's probably going to be a little bit lower. So we've been watching that, and there is a very clear statistical trend of a downward trajectory over the last 18 days.
looking at it that it was an actual decline in the number of cases over the 14 days instead of a decline in the increased number of cases?
That's a good question, because you have to keep that in context with your denominator of testing. And so if you...
I'm just trying to, I guess it's something that's been brought up, and it may be a misinterpretation of what that guideline is. And that's where I think the question keeps coming up.
I understand, and it's a legitimate question. The response is that you have to keep it in context of how much testing you're doing. In theory, hypothetically, we could artificially reduce that number by reducing the number of tests. If we only do 5 tests tomorrow and 1 is positive, then we only have 1 confirmed case. But because we're expanding our testing by leaps and bounds day over day, that's why you have to look at rates. Because yesterday we added 7,500 tests, but only about less than 200 of them were positive. And so you have to keep that overall positive case count in context with your denominator of testing, because the more you test, the more you're going to find, and that's exactly what we want.
Thank you.
Thank you.
Next, we'll go to Kathleen Jacob with Fox 17. Kathleen, your line is open.
Sure. Thank you again, Governor, for taking our questions. I know we're talking about reopening, but right now still so many Tennesseans have not seen any unemployment benefits. And the biggest concern that I've heard from them are major website issues, whether that be, I spoke to a woman who couldn't even log in today. Her application has disappeared, people dealing with questions that don't make sense, and then they're not able to get help when they're trying to fill out these applications. So my question is there a push on you guys' part to, I guess, upgrade this website and just make it more user-friendly so that people are struggling with one less thing right now?
Yeah, there's actually a major push for that, and I appreciate that question, because so many Tennesseans have had to deal not only with unemployment and the loss of a job, but then with the challenges of dealing with unemployment benefits. And certainly our system has been significantly strained. As you know, when this began, the increase in our unemployment benefit applications immediately increased by about 25 times over a week period from the previous week. So 25 times more folks have applied, and those are hundreds of thousands of people that have been applying for those benefits. We've absolutely been strained. It's been a challenge. We have upgraded our system as of this weekend. There is an indication that is working significantly improved in the last day or two, but we'll continue to work. We have a great push there. We've employed a couple hundred extra folks into that department to try and relieve this strain. So we recognize this has been a great challenge for the greatest challenge for those who have lost their income and who are dependent on unemployment benefits. And because we know that challenge is so great to them and we want to be helpful, we've put a great push on that. And we believe, and we have seen, by the way, hundreds of thousands of people have gotten those processed, but we've seen improvement in the last few days, and we hope to believe and continue to see improvement in the next few days.
Okay, thank you. I appreciate it.
Thank you.
Next, we'll go to Larry Stone with News Talk 94.1 in Cookeville. Larry, your line is open.
Thank you for taking the question. For Dr. Piercy, do you have a sense at this point of what the lag time is between someone getting a test and when that data is reported either to them or in the state numbers?
Yeah, so the answer is it varies. And I'll tell you, there are a couple of variables in there that you have to keep in mind. I do want to acknowledge that there is a delay in the Bledsoe County numbers. We talked about that yesterday. And that's because one of the delays that might happen is a delay when the lab tells us about the positive result. That is supposed to happen within 24 hours, but quite frankly, a lot of these labs are completely overwhelmed with getting hundreds and now sometimes thousands of tests per day, and sometimes that's a little bit slower than we would like. However, please know that that does not in any shape, form, or fashion delay notification of the patient. So we've talked several times before about all of the different time gaps during the process. So usually a patient gets sick, and then a few days later they get tested, and then between 2 to 4 days on average, they get their result back. Sometimes that's as little as 24 hours. Sometimes we've seen, at least in the past, not so much now, that the lab result can take up to 7 days. We are watching all of the labs in the state and really all over the ones that we use all over the nation, keeping an eye on their turnaround times. Our state lab is a 24 to 36 hour turnaround time, and most of the ones in the state have no more than 2 to 3 days. There are still a couple that are taking longer than that, and quite frankly, we try not to use those that are having longer turnaround times. So there may be a lag in how long it takes the patient to know, and then there might be another lag in getting them reported officially. But I want to reemphasize that as soon as that result comes positive, the patient is told, and that's the most important part.
A follow-up on that, how important is it to decrease that amount of time that it's taking as you begin to try to reopen the state?
Sure, it's incredibly important. But interestingly, that brings up a point that you need to remember. Case counts are oftentimes several days after the patient starts getting sick. And we even know that patients can be infectious a couple of days even before they show symptoms. So the worst thing you can do is wait until that number clicks in your county before you think there's a case, because there's been a case long before then, and there's all of that that takes place before then. Likewise, when you look at hospitalizations and deaths, those are what we call a lagging indicator. And that means that sometimes it's 2 or 3 weeks later, just how long it takes the illness to manifest, and then how long it takes for the person to be hospitalized for those numbers to pop up. So the most important part is to pretend like or act like everybody's infected and that you're infected, so you don't pass it on to someone else. That's why physical distancing and social distancing are way more important than the numbers on a chart.
Thank you, Doctor.
That's all the time we have for questions today. Governor, if you would like to make a closing statement.
Again, thank you everyone for joining. We do remain encouraged by the numbers. We're encouraged by the fact that we're at a place where we can begin to open up our economy and to get Tennesseans back to work. We have challenges before us, all of us do, in the ways that we address these challenges. They're very important to us and they're very important to Tennesseans. But take heart, stay encouraged, continue on the path that you are continuing now. In spite of the changes that are coming to our state ahead with regard to rebooting and reopening and folks getting back to work, we cannot change our commitment to social distancing. We cannot change our commitment to the habits that have gotten us here and will get us safely through the next phase of this reopening. Thank you very much, Tennesseans, for doing your part and staying apart.